Our next discussion is on medical legal issues by Dr. Pratibha Kane, madam. And I would like to request Dr. Vikas Kurekar sir, Dr. Divanmal sir and Dr. Shankar Gosavi sir to chair this session. Dr. Vikas Kurekar sir is a retired professor and HOD anesthesia at GMC Miraj. Dr. Divanmal sir was an associate professor at Bharati Vidyapit, Sangli. And Dr. Shankar Gosavi sir is a senior anesthesiologist at Satara, and he has completed diploma in medical legal sciences at KIMS. We welcome you all.
Good evening, everybody. All right, I can see very few people in the hall, but just please put on the lights and let us see everybody. Okay, today my topic is medical legal aspects of anesthesia, what I should know, and I really thank the organizers for this invitation, and I really thought there would be many students here, so what they should know, and getting a PG assembly to be aware of medical legal aspects was, I thought, really vision which is well appreciated. Please put on the lights. My slides are quite fine. All right, so importance of having medical legal knowledge along with your clinical acumen, I think, is the need of the day, because look at this, okay? 5.2 million medical negligence cases against doctors, and this is April 24 data. And the reason for this is very important. The patients are aware of their right to information, autonomy, and the right to get their compensation, right to make the doctor accountable. And there is much medical jostling, and aggressive patients today can sit in their drawing room and lodge FIRs. They can also put in consumer cases. So things are going to definitely become a little more difficult. The one medical legal event can not only affect your practice, but can affect your life. And we have seen what happened to Archana Sharma. She was under tremendous social and political pressure due to a PPH, which is a common complication. But the way things turned up, she could not bear that pressure. Knowledge is what we need, and to prevent litigation, and not just that, offer a formidable defense, because we cannot afford another Archana Sharma. So what I'm going to do in this short time is just make you aware of all the law that is important for doctors, and later we will just look at how law affects our day-to-day practice. So to start with, the most common allegation is medical negligence. Medical negligence is an act or omission which a prudent or a reasonable doctor would not do or commit. Law of medical negligence is not codified. So to prove medical negligence, the opposition has to do two things. Okay, they have to prove that the doctor did not have the necessary skills. And this really actually is to show that the doctor was not qualified or did not have the necessary certifications. The doctor also, the second thing is that he did not exercise this right or the skills that he has learned according to standard of care, which is available in that locality, and that time is also important. Now, everybody knows that when we agree to give any anesthesia, we have already started a legal duty. There has to be a breach of that duty, and the breach is any injury which happens during giving this anesthesia, and this has to lead to some damage, okay? So there's an injury, there's a significant damage, and the patient wants compensation. So these are the three things that are required if negligence has to be proved. And there are three most important areas where a patient can go to get compensation. If you want a monetary compensation, it is the Consumer Protection Court under the Consumer Protection Act of 2019, which is really even more dangerous than the one before. Then you can go to file an FIR in the criminal court if you just want to see the doctor harassed and behind bars. And the third is to suspend or have some revoke our license to practice, that is in the medical council. So is the anesthetist liable? Means anesthetist may not have a direct contact with the patient, but it is very, very proved with this case of Dr. Rashmi Fadnavis that anesthetist is an independent consultant hired for his profession. He is not under the direct orders of the hospital or the surgeon, so he is using his own professional knowledge. And the patient pays for his services, so he is accountable. So we have, under medical negligence, we can have a civil or a criminal negligence case. Now, civil negligence, like I told you, is under the Consumer Protection Act. It is called deficiency of service. And you can put anything under deficiency of service. Principle of vicarious liability for acts for your residents, acts for any untrained staff who is working directly under you, under your orders, is applicable in the civil, under the CPA. Limitation period is for 2 years. But if you want to bring a suit in criminal negligence, there has to be something which is called gross negligence, which is recklessness, callousness, sheer lack of concern for safety, and an intention to do some harm. The problem is that gross is very subjective, and what I may feel is gross, somebody else may not. Now, the criminal machinery is set in motion when the patient's relatives go to the police station and file an FIR. So the police inspector, he goes and does some preliminary investigation, and usually if there's a death, then this law is set in motion. The commissioner, he sets up a board or an expert committee, and they have to appoint from your documents whether this falls under gross negligence. So you can imagine the responsibility of the expert committee. Okay, so it's only after the expert committee finds gross negligence, the police will take further actions, maybe to arrest us. Now, Jacob Matthews, versus State of Punjab, this is a very, very important case law for any doctor, because this gives guidelines to protect doctors from indiscriminate action of the police. So, in fact, we are all advising that you should just keep it on your mobile phones, because many police officers do not know about this, unfortunately. And they can, come to arrest. Now, the doctors have certain rights, but you have to enforce them through a criminal lawyer, and you have a right to bail, you have a right to appeal to a higher state expert committee, you have a right to defer arrest, because you have to tell the police that we are not going to run away and we will assist in the investigation. And later, you can also squash the FIR under the BNS 2023, Section 528. It used to be IPC 482. Now, in this case, on the other side, the criminal proceedings have been squashed because there was no expert committee opinion. So one must know this. So the punishment, there's a lot of social media about punishment for doctors. So anybody who is a registered medical practitioner, if all this is proved by the expert committee and in the court case, if criminal negligence is proved, then the punishment is 2 years with fine. All other doctors, dentists and everything, it's 5 years. Vicarious liability is not applicable in any criminal case, and there is no specific limitation period. Anytime these cases can be brought up. Now, there are other statutory laws. Statutory laws are the ones which are made by the Parliament, and these are very strictly enforced. So, Transplantation of Human Organs and Tissues Act, so illegal transplants, illegal MTPs, the anesthetist can be held as a co-conspirator. If you are using the ultrasound machine, you have to be registered with the local PCP and DT authority. We are also liable under the Narcotics, Drug and Psychotropic Substances Act, the Drugs and Cosmetics Act, the Schedule H and Schedule X lists we must be familiar with. There are certain licenses are required for possession, storage of these drugs and also for transport. Okay, I just wanted to bring in the POSCO Act because I'm seeing in the last 6 months, many doctors have been implicated under POSCO. And when we are using so many hallucinating, dissociative, and sedative drugs, any allegations can be made about improper touch, okay? And we must always have something which is called a chaperone culture. Please see that there is a female attendant whenever there is any young or any female patient. This is just a case where Kerala doctor has been allegedly misbehaving with teens. So we also need to be slightly careful. Breach of confidentiality is extremely important today, and I really want to bring it up. Confidentiality, privacy, surgeons are making us take pictures. They are all lying on our phones. Please see that you delete them. These 3 doctors, they were anesthetists, they just were taking pictures of a triplet delivery, okay? And to date, they have not got bail. All right, law on euthanasia, I have taken this because I thought students would be there. This is the Aruna Shanba case, which is decided in 2011. It differentiates active euthanasia from passive euthanasia, which is for everybody's interest. I will just tell you what it is. So active euthanasia, everybody knows mercy killing or good death is euthanasia. It is of 2 types, active and passive. Active is voluntary euthanasia. The patient can sign and say, I don't want to live anymore and I want to end my life. That is illegal in India. And so these are the sections. Physician-assisted suicide is illegal in India. But what is legal after this case is passive or non-voluntary euthanasia, where the consent is just not available because the patient is in a vegetative state. So what they have said is very interesting. Passive euthanasia, the doctors are not actively killing patients, they're just not saving the patient. Okay, I'm not going to go this. All right, so we have to also be very careful about professional misconduct. Actually, 2023 guidelines had come in. They have been retracted for some time, but this will come in the near future, not to practice beyond your qualifications, especially super specialty. and to be associated with non-qualified persons was specifically mentioned in the 2023 guidelines. And the NMC can take actions like send you warning notices, suspend your license for a short period, or permanently revoke your license. All right, so now coming to anesthesia practice. Pre-anesthesia check is a non-negotiable standard of care. I'm not going to go into the details of the thing. Not documenting itself is held as negligence in many, many cases. Consent, most litigated document, consent in healthcare is a permission given by the patient who is competent for any treatment. And when we take consent, we are paying respect to the patient autonomy. Okay, two major things that are required. Every doctor must seek and secure valid consent. Two things are required. Patient must be competent, that is more than 18, not under the effect of alcohol or drugs, and in a good mental condition. And second is the consent must be based on adequate information. And this adequate information is also given, nature and procedure, nature of the procedure, its purposes, benefits, alternatives if available, outline of substantial risk, and adverse consequences of refusing the treatment. And but a fully informed consent as of now is not required, but I'll just read what is given in 2008, that there is no need to explain remote risks more than 2%, but anything more than 10% risk must be disclosed. But at that time, they have said that the medical practitioners and hospitals become more and more commercialized, and if there is an increase in the awareness of patients' rights, then informed consent has to be considered. So if your patient is asking you difficult questions, you must give proper answers. Okay, I am just saying that all blocks under anesthesia also separate consent, you must mention them. Death on table consent is considered very bad in law because you are asking the patient to write his life away, and that is not considered very legal. And but a high-risk consent, you can say inability to, kind of revive cardiac arrest and things like that can be mentioned. Emergency, no consent is required, and if you do wait for a consent in an emergency, you will be held liable. Consequences of an invalid consent, its deficiency of service, its professional misconduct, and you can also go into criminal litigation. In Pune in 2019, 11 doctors were held liable for a consent which was not taken for a cardiac surgery, mitral valve replacement. Death was not explained. Intraoperative, worst to defend is wrong side, wrong patient, wrong surgery. Also, the most important allegation of intra-op thing is drug errors and anesthesia overdose, and you can be booked in any of these. Lack of defibrillator, okay, many case laws, and it is, you have to have a defibrillator in the premises. Lack of a ventilator, this is a criminal case, and they have also brought in it is to be read with section 34. That means it's like criminal conspiracy, means the surgeon, anesthetist, and the nurses are all implicated for actually killing the patient. So that is the section 34. Today it will be section 3/5, which is criminal conspiracy. Entitled CO2 monitoring, CO2 embolism in this patient, 33 lakhs of compensation. And it is really advisable that for all laparoscopic surgeries, one should use an ETCO2 monitor. NORA practice, again, a deficiency of all kinds of infrastructure, and one must bring it up to spec, because the anesthetist is getting badly mangled in many, many cases because they are taking the risk. Documents is actually the evidence of our high standard of care. In this case, CPR notes were not written, and it was held as res ipsa loquitur, means you do not need to explain anything. 57 lakhs this is in a corporate hospital, Apollo Chennai. Fabrication of documents. In this case, the patient had fallen from the operation table. The notes all said that this was cardiac arrest due to anaphylaxis. And look at the compensation, it's 1.6 crores, though 10 lakhs to the anesthetist, but the rest has to be paid by the hospital. And they say that you alter the notes and you lose the case. So you have to be really very, very careful for when you alter your notes. The surprising part of this case law was the gynecologist managed to get away by saying, I didn't even touch the patient. Okay, I'm done. Post-op complications are also our responsibility. This is a post-spinal hematoma, okay, which was missed. Basically, when you're giving any spinal regional, especially in patients who are on clopidogrel or aspirin, please check that within that time the patient has started moving legs. Keep at least a phone call, because if you miss this patient has landed up in paraplegia because it was missed for 14 hours. Who is responsible for the patient when the anesthesiologist leaves is a very big question mark. Everybody must be very, very aware that yes, for some time, anesthetists would be held liable. Transfer of patients in this case, which has happened just very, very recently, I think it is March of this year, a patient had cholecystectomy being done. There was some injury to some blood vessel, bleeding patient. They couldn't control the bleeding. They have sent this patient to a higher center with technicians. And of course, the patient has succumbed on the way. So the best thing you can do for yourself in adverse events is call for help, call for senior colleagues, call for a medical legal expert, ISA office bearers, because what happens in the first few hours, it really, really determines our legal consequence. And we must keep our focus on patient safety and ensure that our documents will stand legal scrutiny in years to come, because average time for any case to reach High Court or Supreme Court is about 10 to 12 years. Thank you very much.
Thank you, madam. You had nicely covered the topic, and most important thing she had covered is what we should know and in which case we should take precaution. I will like to add one important thing in this. Today, Aple Bal Venkat sir said, whenever we administer anesthesia, we must see the less morbidity and no mortality. So it is always based on you must have your good documentation to avoid the law. And second important thing is that to prefer any anesthesia where the less risk to the patient, less risky complication to the patients, and documentation is most important. And because why I am saying this, I was superintendent for 5 years. I had been in the committee as a chairman for 5 years, and I had seen the cases or given the result to more than 60 to 70 cases. And let me tell you, many times I have to protect my colleagues only to find the documents, how I can give safe reports. And we had given, but it is now my request. Now the days are different. Everyone is now can file a suit against you. So it is always better to take precaution and do the evidence-based medicine practice. Thank you.
Thank you so much, ma'am, for this exceptional talk.
There are many surgeries of NJPJY, and they take photos of all surgeries, all patients, start from anesthesia to
Anything that you see on your whoever is taking and whoever is doing what, please don't get into this. If they have to send it, let them send it. Do not keep them on your personal phones. Do not keep any patient data on your personal phones, okay? By mistake, if it gets carried forward, and do not put it on any social media. You are responsible. They can track any communication on social media to your phone.
One thing I would like to what we do recording the knowledge take patient's consent that you are going to put it in the media or public. We know it, so it's that consent. Patient, we have a proper consent, separate consent.
So if you want to use that data for research, you are taking formal consent, because without that, they won't give you ethical committee clearance. And if you want to use it for your for presentation, you have to take a proper consent and keep it with you. But throwing it on social media, as much as the patient may give you consent, you don't do it. Not on social media.
Excuse me, madam. With the consent of our relatives, whether we can take a video shooting while explaining everything regarding a patient's complications or any progress of the disease or
No.
such.
If you need it to keep it for record, okay, you have to take the patient's consent. You have to say it is for educational purpose. That is what we have a standard format, and we take patient's name, patient's thing, patient's signature. If patient can't give the signature of the relative, especially husband, wife, whatever, and you have to keep it in your file, keep it on your desktop, don't keep it on your phone.
No, I'm asking about medical legal problems, whether it is acceptable
Yes,
and we
if
can
you
produce
take,
in a court
of
of law.
course, no, there is nothing wrong in taking videos of whatever your procedure or whatever. Today, what has happened is that this privacy thing has become very, very, people are using it against doctors. Okay?
Because sometimes
So,
what-
Excuse me,
POSCO,
sir,
they
we are
have-
running short of time. Please discuss
Okay,
personally.
I'll answer
We
this.
have to finish 2 lectures more. I request escort committee to escort the dignitaries
Thank you,
to the
ma'am.
felicitation venue. Thank you, chairpersons. Thank you, Kane ma'am, for excellent lecture.